Hello everyone. Today we'll discuss about the topic gout. So there are many types of arthritis. There are 127 different kind of arthritis. Rheumatoid arthritis. Rheumatoid arthritis is a severe inflammation that involves many joints and moves beyond musculoskeletal system. Gout. Gout is a very painful form of arthritis characterized by the formation of uric acid crystals and severe inflammation. And osteoarthritis is a progressive degeneration of joint cartilage and minor degrade of inflammation. So among this one type is gout. Gout. Gout can be defined as the pathological reaction of the joint due to the accumulation of monosodium urate crystals. So gout is a metabolic disorder of purine metabolism characterized by acute pain, swelling and inflammation. So at the end of this purine metabolism, end product of this purine metabolism is uric acid. So this increased amount of uric acid, it get converted to monosodium urate crystals, and these crystals will go get deposits on the synovial fluid or in the synovial space, causing a disease condition called gout. So it is always caused due to hyperuricemia. Hyperuricemia is nothing but increased amount of uric acid in the blood. So it is of two types: primary hyperuricemia and secondary hyperuricemia. Primary hyperuricemia is nothing but it is completely associated with the uric acid levels directly. So gout with no associated condition, only the uric acid level will be increased. And idiopathic urate overproduction and HGPRT deficiency. Secondary hyperuricemia is something caused due to the associated condition. So gout associated with other condition or other disorders, so developed during a course of other disease. Some drug may also cause this secondary hyperuricemia. For example, thiazide diuretic may also lead to increased amount of uric acid in the blood. And some other disorders like diabetic ketoacidosis, psoriasis, hemolytic anemia can also cause a secondary hyperuricemia. Risk factor of gout includes diet rich in seafood, male after the age of 20, female after menopause, high body mass index, and excess alcohol intake can also increases the purine metabolism. So the diet which enhances or increase the purine metabolism will obviously increase the level of uric acid in blood. And symptoms include joint pain, joint inflammation, fatigue. Complications are joint deformity, osteoarthritis, tophi. Tophi is nothing but the swelling of the joints, renal stone, and obstructive renal disease. So this how the uric acid level increase in blood. So after the purine metabolism, it get converts to hypoxanthine, and from that it converts to xanthine and to uric acid. And this happens due to the presence of the enzymes called xanthine oxidase. So xanthine oxidase is an enzyme which involves in the conversion of hypoxanthine to xanthine and xanthine to uric acid. So when the uric acid level get elevated in the blood, it forms a monosodium urate crystals and it get accumulates on the joints, causing a tophi. So again, if it is left untreated, it go get deposit on the kidney. Hence it is waste product which has to excreted by the kidney. It will go get deposit on the kidney. So pathophysiology of gout. So increased uric acid in blood react with sodium and form a monosodium urate crystals. And this get deposit in the soft tissue and joints, forming inflammation in the joints. So infiltration of granulocyte, that phagocytoses the urate crystal, which means it engulfs the monosodium urate crystals and it get accumulates in the kidney. And it accumulation of monosodium urate crystals on kidney, again it gonna reduce the function of the kidney. So diagnostic study of gout. So obviously we know that it is about uric acid level. So serum uric acid level will be diagnosed, and WBC cell count can also be done. In the case of gout, WBC white blood cells will get elevated during this gout disease, and erythrocyte sedimentation rate can also be done, and 24 hours urine uric acid level will be monitored, and synovial fluid aspiration. The synovial fluid will be aspirated from the synovial space, there where the monosodium urate crystal will get deposited, which causes your disease condition called gout. So X-ray will show you a toffee, so that X-ray will also be done. Here in this video you can able to see the immunological response is also happening against the monosodium urate crystals. So obviously when the inflammation happens, immuno response happen in the increased range. It again, it forms you a autoimmune disorder. Acute and chronic gout. Acute is the early stage, where chronic is a it is a severe condition where frequent of attacks increases. So in acute gout, there will be a painful arthritic attack. Arthritic pain worsen progressively and generally involves one of few joints like ankle, heel, knee, wrist, elbow, and fingers. The painfulness will be there, and that is the early stage of the gout. And in the chronic gout, frequency of attack increases, continuously deposit leads to the damage of joint and chronic pain. So patients may develop large subcutaneous tophi in external ear, eyelids, nose, and around the joints. So the urate crystal in kidney leads to renal disease simultaneously, and the articular cartilage may be destroyed, result in joint deformities. Classification of drugs used in gout. In the case of acute gout, NSAIDs, nothing but non-steroid anti-inflammatory drugs will be prescribed, and corticosteroids and colchicine. In the case of chronic gout, either by inhibiting the uric acid synthesis or by increasing the uric acid excretion. Through this two way we can able to stop the uric acid production. So inhibit uric acid synthesis, drugs like allopurinol will do that, and it is a standard commercial drug for the gout. So to increase the uric acid excretion, we use certain drugs. So allopurinol will prevent the synthesis of uric acid by inhibiting the enzyme xanthine oxidase, resulting the reduced plasma urate level. So this is a mechanism where hypoxanthine is getting converted to xanthine, and xanthine is further getting converted to uric acid in the presence of enzymes called xanthine oxidase. So this allopurinol will inhibit the action of these enzymes, which in turn reduces the production of uric acid. So increased amount of xanthine and hypoxanthine are excreted through urine. Thank you.